Hi, my name is Sarah DK, and I'm going to be presenting on typhoid fever, otherwise known as slow fever, enteric fever, or nervous fever. The infectious agent of typhoid fever is called Salmonella enterica stereotype typhimurium. It's a gram-negative bacteria, and it is bacillus, so it's rod-shaped, as you can see in the picture. It's also a flagellated bacteria, so that means it has these small hair-like structures that grow out of it, which it helps with movement and chemotosis within the cell. It's also aerobic, which means that it requires oxygen for cellular respiration, energy, and reproduction. The only reservoirs are human reservoirs. It's part of the Enterobacteriaceae family, and other members of this family are E. coli and Shigella. So E. coli causes UTI and diarrhea, and then Shigella causes diarrhea, fever, and stomach cramping. It replicates within the reticuloendothelial system, and this is the hallmark of the infectious agent, because this system consists of various cells of the body that remove dead or abnormal cells, tissue, and other foreign substances. And this is, again, where the infectious agent replicates. Worldwide, there are about 11 to 21 million cases of typhoid fever each year, causing 65,000 to 188,000 deaths. In the United States, it's drastically lower, only leading to about 5,700 estimated cases. And though there isn't a recorded number of deaths, really, 620 people are hospitalized, but it is significantly lower in the U.S. than the prevalence is lower in the U.S. than it is the rest of the world. Some of the at-risk populations for typhoid fever are underdeveloped countries due to their lack of proper sewage and clean water. Also, these populations tend to not really practice proper sanitation and hygiene, which also is a major contributor to it being more prevalent in these areas. And then those traveling to these underdeveloped countries are extremely at risk as well, which is why it's highly recommended, if not required, to have the typhoid fever vaccine if you travel there. As you can see in this picture, Africa and Southern Asia are the main areas of prevalence for typhoid fever. The blue means that it's waterborne, so this is why proper sewage is so important and having clean water. But there are also little areas of foodborne, and even in the United States, which is the orange part. And then there are a few areas in the U.S. and over here of direct contact. And the direct contact in the U.S. was probably a U.S. citizen traveling to one of these underdeveloped countries and then bringing it back. So the transmission of typhoid fever is fecal-oral route, person-to-person transmission. So asymptomatic carriers can still have typhoid in their stool for up to a year after they've actually been infected. And this is the same with someone who is recovered. They can still be carriers of the bacteria, of the infectious disease, and they can infect other people. Eating food or drinking water that has been contaminated with feces is also obviously a major transmission, and the same goes for sewage transmission. And I'll get into sewage transmission a little bit later and the importance of having proper sewage. But in this graph, this is actually called the 4F chart, and this really helps you visualize how it is transmitted. So again, it starts in feces, and if there's a lack of sanitation or hand washing, it can infect fluids, fields, flies, and fingers. Fluids being like water mainly. Fields, like if it's in the soil and then food grows out of it. Flies. The main interesting part with flies is back before automobiles were invented, there would be horse manure all over public streets. And first of all, that was unsanitary as is, but flies would land on this manure and then carry it to all over the city, all over the population. And then fingers again, if you don't properly wash your hands after going to the bathroom. So if there is a lack of safe water, the fluids and also fingers can directly contaminate a new host, but all four of these can contaminate foods, which then the new host will eat and contract the disease. So the symptoms of typhoid fever are mainly in like stages, which are about a week each. So stage 1, there are pretty basic symptoms, like increase in body temperature, the fluctuating fever, decreased white blood cells, and these white blood cells help to fight against infections, like bacteria, viruses, and germs within the body. 25% of patients get bloody noses, and at this point in time, blood cultures will come back positive for the infectious agent. So for S. typhi, it'll come back positive or accurate, but this is too early for the Widal test to be accurate, which I'll get into a little bit later. For stage 2, which is normally week 2, patients will experience extreme exhaustion, have a really hard time getting out of bed. They will have about 104 fever with bradycardia, which is a really decreased heart rate. They'll experience delirium and agitation, so they'll be really delirious, but also they will get agitated really, really quickly. They'll develop these rose-colored spots on their lower chest and abdomen. They will have a distended and extremely painful abdomen as well. Their spleen and liver become enlarged and a little bit tender. Some patients experience diarrhea, and at this time, blood cultures may come back accurate, but the Widal test is extremely accurate at this time. So the third and last stage is about in week 3, and this, if you are not being treated at this time by antibiotics or something else, then it will be extremely dangerous and fatal often. So you can people can experience intestinal hemorrhage, which is bleeding within the intestines due to a broken blood vessel, intestinal perforation in the distal ileum, which is often fatal, encephalitis, which is the inflammation of the brain, respiratory complications, some neuropsychiatric symptoms. It's been recorded that people start to pick at their bedcloths like uncontrollably, or they'll be reaching for imaginary objects. This delirium increases dehydration. 33% of patients develop a rash on the trunk of their body, and then there's often a low platelet count. So for the diagnosis of typhoid fever, there's 3 types of tests, all serological, the Widal test, Tubex, and Typhidot test. The second 2 are rapid diagnostic tests, so you'll get the results in 2 to 3 days. But for the Widal test, it's not rapid, so it is more time consuming, but it's probably the most accurate, especially during stage 2. As you can see, so how the test works is it's a serum mixed with dead bacterial suspension of salmonella that has antigens on it. And so if you can see within the mixture that there's clumping, this means that the antibodies are fighting against these antigens. So with the first 4, you can see that there is clumping. There's a lot of clumping right here, and then there's still clumping in this one. So this means that this patient would have typhoid fever, but if there's no clumping at all, then it means that you do not have the disease. So in order, some prevention for typhoid fever is just practicing basic sanitation and hygiene, careful food preparation, washing your food really well in clean water, and then if you are like not eating your food raw, then boiling it, and which will get all the bacteria off. Thorough hand washing, really, really simple, really easy, but effective way to not contract the disease, because after you go to the bathroom, you just don't want to have that bacteria on your hands and infect yourself and everyone else. The CDC stated that chlorination in water has decreased transmission in the U.S. drastically. This actually started in 1908 in the U.S., is when it was first adopted. It started in New Jersey City, New Jersey, and then after that it was implemented. Some permanent chlorination systems were implemented in cities all over the U.S., which is a major reason why the U.S. is so much lower in typhoid cases than Africa and Southern Asia and even Europe. However, the best prevention is always going to be vaccination. So the two types of vaccines are the Ty21A vaccine and the VIPS. The Ty21A is chemically mutated Ty2 strain of S. typhi. It's administered in capsules, which causes there to be an age requirement of 5 years or older because you don't want little babies having the capsules. It's a live attenuated, which means it presents the S. typhi bacteria in a mutated way to the body. And then revaccination boosters are also recommended every 5 to 7 years, which leads to a 51 to 67% efficacy. And then the VIPS vaccine is a purified VI capsular polysaccharide Ty2 S. typhi strain. It's an injection, so that means that the age requirement is 2 years, 2 years old or older, since it's just a shot. It's a subunit vaccine, so it presents only part of the S. typhi bacteria to the body. It also does, boosters are necessary for it every 2 to 3 years, but it has a little bit more efficacy at 55 to 72%. All right, and that is it. Thank you so much for watching, and I hope you learned a little bit about typhoid fever.